Gentlemen, let me ask you something honestly. How often does your partner actually reach climax during intimacy? Be real with yourself. If the answer is rarely or not consistently, I want you to relax. You are not alone. I'm Dr. Lena, and for over a decade I've worked with men over 40, 50, and beyond who want to restore confidence, stamina, and deeper connection in their relationships. Before we begin, take 1 second, tap like, subscribe, and comment below where you're watching from. I truly read your comments, and it reminds me that this isn't just a video. It's a real conversation. Now let's talk about the truth. Most women do not reach climax from penetration alone, and that is not a flaw in her, and it is not a failure on your part. It's biology. Research consistently shows that blood flow to the clitoral area is the strongest physical predictor of female climax during intercourse. More blood flow means more arousal. More arousal means a higher probability of climax. So if she isn't finishing consistently, the issue usually isn't or performance. It's positioning, it's alignment, it's rhythm, it's understanding anatomy. Many men assume they need to go harder, faster, deeper. But science shows something different. Precision beats power. Control beats speed. Connection beats force. Over the years, I've worked with men dealing with performance anxiety, desire mismatches, and frustration around partner satisfaction. And what I've seen repeatedly is this small, intentional adjustments create dramatic results. Not gimmicks, not tricks, not unrealistic expectations, just biology applied properly. Today, I'll walk you through 4 science-backed positions that significantly increase the likelihood of female climax. And more importantly, I'll explain why they work. Because when you understand the why, everything changes. Let's begin. Position 1 woman on top, face to face. Why does this work? Control. When she's on top, she controls depth, angle, and rhythm. Ultrasound studies show that this position increases blood flow to sensitive external structures because she can naturally adjust pressure and movement. Blood flow equals arousal. Arousal increases climax potential. But there's something else here. Emotionally, she feels empowered. Confidence plays a major role in female arousal. When a woman feels safe, confident, and in control of her pleasure, responsiveness increases dramatically. Here's your practical tip: instead of thrusting upward, stay stable. Encourage her to experiment with rocking motions, subtle tilts, small shifts in hip angle. Even tiny adjustments can change stimulation completely. This position is often the gateway to more consistent satisfaction because it allows discovery without pressure. Now let's move to position 2. Man on top with a pillow under her hips. Simple, but powerful. Placing a pillow under her hips tilts the pelvis slightly upward. That tilt changes everything. It directs more pressure towards sensitive external tissue during movement. This small adjustment can significantly increase stimulation without increasing intensity. And emotionally, this position encourages eye contact, closeness, slow synchronized motion. She feels seen, she feels connected, she feels wanted. And emotional safety amplifies physical response. Try 1 pillow. That's it. You'll be surprised how something so small creates such a noticeable difference. Now position 3, the alignment technique, sometimes called the rocking variation of missionary. Instead of traditional thrusting, you shift your body slightly higher and focus on controlled rocking. The goal is continuous contact, not deep repetition. Why does this work? Because consistent external stimulation, not depth, is what most women biologically require to reach climax. Rocking maintains contact. Thrusting often breaks it. When you stay aligned and move together rhythmically, stimulation becomes sustained instead of intermittent. This position alone has helped many couples move from frustration to reliability. The key here is communication. Ask softly, does this feel good? Adjust in real time. Presence is everything. Now position 4, sitting face to face. This one is less about intensity and more about connection. The stimulation is moderate, but the closeness is powerful. Eye contact, breath synchronization, hands exploring slowly. Emotional intimacy can increase arousal more than mechanics alone. You can enhance this position with subtle angling, gentle rocking, or even adding manual stimulation if needed. Remember, it's not about proving anything. It's about discovering what works together. Now, let's summarize what truly matters. It's not the position alone. It's rocking instead of pounding, alignment instead of depth, precision instead of speed, communication instead of guessing. And gentlemen, don't forget your own health. Circulation matters. Cardiovascular health matters. Hormonal balance matters. Natural lifestyle strategies, exercise, sleep, stress control, support blood flow and stamina. Some men also explore evidence-based supplements that support vascular health and testosterone balance, but always prioritize safety and speak with a healthcare professional. Every woman is different. There is no universal formula, but there is a universal principle: presence, curiosity, communication. Sex is not a performance, it is collaboration. Your action step this week is simple: choose 1 position. Make 1 small adjustment, stay present, ask for feedback, observe, adjust. That's how confidence grows, that's how connection deepens, and that's how intimacy evolves at any age. If this helped you, let me know in the comments which approach you'll try first. Like, subscribe, and share this with someone who needs evidence-based guidance instead of myths. I'm Dr. Lena. And remember, desire does not disappear with age. With understanding and intention, it improves. I'll see you in the next video. Take care of yourself. You deserve a confident, connected, and fulfilling relationship. Gentlemen, can I ask you something straight? And I want you to really think before answering. How often does your partner actually reach orgasm during vaginal sex? Not what you assume, not what you hope, not what you think should be happening, but what actually happens. Pause for a second. If your honest answer is rarely or not consistently, or I'm not sure, don't panic, don't feel attacked. And please don't feel ashamed. You are not alone. I'm Dr. Lena, a urologist and men's health specialist, and for over 12 years I've helped men over 40, over 50, and beyond reclaim sexual confidence, stamina, emotional connection, and true intimacy. And let me tell you something important right now. Most men are never taught how female orgasm actually works. They are taught performance. They are taught endurance. They are taught size, speed, stamina. But they are rarely taught biology. Before we dive in, do me a quick favor. Hit the like button, subscribe, and comment below where you're watching from. I genuinely read your comments. And when I see men opening up, asking questions, sharing experiences, it makes this conversation real. Now let's talk truth. Most women do not orgasm from penetration alone, and I need you to hear this clearly. It is not a flaw in her, and it is not a failure in you. It is biology. Research consistently shows that clitoral blood flow is the strongest predictor of female orgasm during vaginal intercourse. Let me explain what that means in simple terms. The clitoris is not just a small external structure. It is a complex organ with internal branches that extend deeper into the pelvis. When blood flow increases to that entire network, arousal increases. When arousal increases, sensitivity increases. And when sensitivity increases, orgasm becomes possible and more likely. So if she isn't climaxing consistently, it is rarely about doing more. It's about doing it smarter. Many men think, I need to go harder, I need to go faster, I need to go deeper. But real science shows the opposite. Subtle adjustments, controlled rhythm, intentional positioning. Those create better results than force. Over the past 12 years, I've worked with men struggling with performance anxiety, desire mismatches, low partner satisfaction, and even relationship tension because of intimacy issues. And what I've seen again and again is this small, targeted, evidence-backed changes can completely transform intimacy. We're talking about pelvic angling, positioning, rhythm control, pressure consistency. These are not tricks, they are biological alignments. And today, I'm going to share 4 science-backed positions that dramatically increase the likelihood of female orgasm, plus techniques you can apply in almost any position. By the end of this video, you'll understand what works, why it works biologically, and how to apply it practically in the bedroom. Quick note, these are not gimmicks. These are not unrealistic adult film myths. These are biologically grounded, emotionally supportive, and practically simple adjustments. Let's start. Position 1, woman on top, face to face. Why does this work? Biology. When she's on top, she controls angle, depth, and rhythm. And that control matters more than most men realize. When she adjusts her pelvis forward or backward, even by a few degrees, she changes where pressure is directed. Ultrasound studies show that this position significantly increases clitoral blood flow on both sides of the internal structure. That increase in blood flow raises arousal levels dramatically. Blood flow equals arousal. Arousal equals orgasm probability. But there's also an emotional component. When a woman feels in control, she feels empowered. When she feels empowered, she relaxes. When she relaxes, her body responds better. Confidence is a powerful amplifier of arousal. Practical tip, instead of thrusting upward aggressively, stay stable. Let her experiment. Encourage rocking instead of bouncing. Encourage tilting instead of lifting. Even hand placement on your chest for support can change pressure angles. The key is exploration, together. This position is often the gateway to her first consistent orgasms during penetration. And sometimes one session of intentional exploration resets the entire sexual dynamic of a relationship. Now position 2, man on top, with a pillow under her hips. This might sound simple, but it's incredibly effective. When you place a pillow under her hips, her pelvis tilts upward. That tilt changes the angle of penetration. Instead of moving straight inward, movement now naturally presses toward the clitoral area. That subtle directional shift increases stimulation. And remember, most women require external stimulation to climax. This small angle adjustment increases that contact significantly. Emotionally, this position builds closeness, eye contact, touch, slow synchronized movement. When emotional bonding and physical stimulation combine, orgasm becomes far more likely. Practical tip: 1 pillow is enough. Too many changes the angle too much. Focus on slow, controlled rocking, not repetitive thrusting. The difference between thrusting and rocking is consistency of contact. Consistency is key. Now position 3, the goal alignment technique, often called K8. This is a variation of missionary. But instead of thrusting deeply in and out, you shift slightly higher on her body, and you rock together. The base of the penis maintains consistent contact with her clitoris. Why is this powerful? Because it provides continuous stimulation, not intermittent stimulation. Most traditional thrusting patterns break contact repeatedly, but rocking maintains it. Research shows continuous stimulation dramatically increases orgasm reliability in women who struggle with penetration alone. Emotionally, this position feels connected. You're close, you're aligned, you're moving together. It feels intentional. Practical tip: focus on sliding and pressure, not speed. Ask her what feels best. Adjust slowly. Even micro adjustments in angle can transform sensation. This technique alone has helped countless couples experience reliable orgasms where there used to be frustration. Now, position 4. Sitting face to face. While not always the most intense physically, this position excels in emotional intimacy. And emotional intimacy amplifies arousal. The closeness, the eye contact, the ability to move slowly, it builds anticipation. And anticipation increases blood flow. You can enhance this position by angling her pelvis slightly, using a pillow behind her lower back, adding gentle manual stimulation. Small tweaks equal big results. Now let's step back. The secret is not just positions, it's principles. Rocking instead of thrusting, alignment instead of depth, precision instead of speed, communication instead of guessing. Gentlemen, let's make this practical. This week, choose one position. Try it intentionally. No rushing, no distraction. Experiment with one adjustment, a pillow, a tilt, a rocking motion. Communicate in real time. Ask her what feels good. Watch her body language. Adjust. Biologically, you're maximizing clitoral blood flow. Emotionally, you're building trust and safety. Practically, you're increasing satisfaction and confidence. And remember, your own health matters too. Circulation affects performance. Hormonal balance affects desire. Sleep, exercise, stress reduction, they all matter. When your vascular system is healthy, stamina improves naturally. Every woman is different. There is no one-size-fits-all formula. But there is a universal truth: sex is not a performance. It's collaboration. It's exploration, it's connections. And when you shift your mindset from impressing to understanding, everything changes. Your action step: one position, one adjustment, full presence, clear communication. That's how consistency is built. That's how confidence grows. And that's how intimacy evolves at any age. Comment below which position you'll try first. Like, share, and subscribe for more evidence-based guidance on men's health, intimacy, and performance. I'm Dr. Lena. And remember, age does not end passion. Intentional practice restores it. Take care of yourself. You deserve this.